This medication helps prevent sudden and painful gout attacks by reducing the swelling and buildup of uric acid crystals in the joints. Gout is caused by too much uric acid in the blood, which can form hard crystals in the joints, usually in the big toe, knee, or ankle. It's important to note that this medication is not meant for pain relief from other causes. The daily dosage and optimal timing of this medication should be determined by your healthcare provider. Before taking Gloperba 0.6 mg per 5 ml oral solution, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once or twice a day. Be sure to measure the dose carefully using a special measuring device/spoon, and do not use a household spoon. The dosage of this medication is based on your medical condition, other medications you may be taking, and your response to treatment. It's important to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Do not increase your dose or use this drug more often or for longer than prescribed. Taking more than the prescribed amount will not improve your condition any faster, and it may increase the risk of serious side effects. To get the most benefit from this medication, take it regularly at the same times each day. Also, it's important to avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe to do so, as grapefruit can increase the chance of side effects. Some common side effects of Gloperba 0.6 mg per 5 ml oral solution may include diarrhea, nausea, cramping, abdominal pain, and vomiting. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, if you experience any of the following very serious side effects, it's important to stop taking the medication and seek medical help immediately: unusual bleeding or bruising, muscle weakness or pain, numbness or tingling in your fingers or toes, pale or gray color of the lips, tongue, or palms of hands, signs of infection, unusual weakness or tiredness, fast heartbeat, or signs of kidney problems such as changes in urine output. Although a severe allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's important to contact your doctor or pharmacist for further guidance. Before you start taking Gloperba 0.6 mg per 5 ml oral solution, it's important to let your doctor or pharmacist know if you have any allergies or if you have kidney or liver problems. It's also important to limit your alcohol intake while taking this medication, as alcohol can make it less effective. This medication may contain sugar or aspartame, so if you have diabetes or phenylketonuria, PKU, or any other condition that requires you to limit these substances in your diet, make sure to talk to your doctor or pharmacist before using this product. It's also important to be aware that Gloperba 0.6 mg per 5 ml oral solution can affect how well your body absorbs certain foods and nutrients, such as vitamin B12. Be sure to consult your doctor or pharmacist for more details. If you're an older adult, you may be more sensitive to the side effects of this medication, especially muscle weakness/pain and numbness/tingling in your fingers or toes. It's also important to note that this medication can decrease sperm production, which may lower male fertility. If you're pregnant, this medication should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. And if you're breastfeeding, it's important to consult your doctor before using this medication, as it does pass into breast milk. Your doctor may recommend separating the times you take your medication from the times you breastfeed. It's important to be aware of potential drug interactions with Gloperba, as they may change how your medications work or increase your risk for serious side effects. This includes other medications that can affect the removal of colchicine from your body, which may impact how colchicine works or increase the risk of serious side effects. Examples of such medications include atazanavir, certain azole antifungals, diltiazem, macrolide antibiotics, ritonavir, telithromycin, and verapamil. Additionally, it's important to note that taking colchicine with other drugs that may also cause muscle damage, rhabdomyolysis, can increase the risk of serious kidney problems. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist, and to not start, stop, or change the dosage of any medicines without your doctor's approval. Also, do not take Gloperba with any other product that contains colchicine, and be sure to inform lab personnel and all your doctors about your use of this drug, as it may interfere with certain lab tests, potentially causing false results. If you suspect someone has taken too much Gloperba and they are experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact your local poison control center for assistance. Symptoms of overdose may include severe nausea, vomiting, diarrhea, abdominal pain, difficulty breathing, and weakness. It's important to seek medical help right away if you suspect an overdose. It's important not to share this medication with others. If you're overweight, drink a lot of alcohol, or eat certain foods, it may make your gout symptoms worse. Try to limit your alcohol intake and ask your doctor, pharmacist, or dietitian about avoiding foods that are high in purines, like anchovies, bacon, beer, sardines, and organ meats such as liver and kidneys. While taking this medication, you may need to have lab and/or medical tests, such as a complete blood count or kidney/liver function tests. Make sure to keep all your medical and lab appointments. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It is important to store Gloperba 0.6 mg per 5 ml oral solution at room temperature, away from light and moisture, but not in the bathroom. Be sure to keep all medications out of reach of children and pets. When it comes to disposal, do not flush this medication down the toilet or pour it into a drain unless specifically instructed. Properly discard the product and it is expired or no longer needed. It is best to consult your pharmacist or local waste disposal company for guidance on how to do this safely. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.